We are moving on with that to our fireside chat now. This chat, of course, is going to ignite the spirit of digital transformation in healthcare across India. We'll be talking about digital communications, a catalyst to healthcare in India. It's a pleasure to invite on stage Mr. Adithya P. Sharma, Vice President Whistle, as the moderator for this fireside chat. And of course, Whistle being the partners, it's truly an honor to have them on board here for making this event possible. And also inviting on stage Ms. Priyadarshini Narendra, Vice President BIRLA Fertility and IVF to join in for the conversations. Requesting all of you to kindly join me in welcoming Ms. Priyadarshini Narendra and Mr. Adithya P. Sharma for a fireside chat.
Good afternoon, everyone. So I head sales and operations for Whistle. We are into communication space where we cater to any digital platform-based communications. And then taking more time, I would probably introduce Priyadarshini, who is from BIRLA Fertility and IVF. You would like to take it forward from here?
Yeah, so I had marketing for BIRLA Fertility and IVF. And since it's a session about digital communications, I've got all my notes on my phone. So if I look at my phone, I'm not doom scrolling Insta. I'm just referring to my notes. So bear with me there.
Okay, thank you so much. To set the background, I would like to give certain facts and data on the overall digital communication consumption, what is happening today with Indian market. And to start with the distribution of multiple channels, what we use to communicate through digital ways is that from SMS, we are catering to around 71% of our communication through SMS, which we don't realize. That's what I always feel, that we don't realize that the extent of SMS consumption is so high when we are talking about digital communication. Apart from that, we have multiple other channels, like be it RCS, be it WhatsApp, which we call it as OTT. So RCS today contributes to around 13%, and OTT and voice contribute to 8% roughly. This is overall communication I'm saying, not specific to health tech. So 8% from voice and 8% from OTT channels, which means WhatsApp. So what I'm trying to convey through this numbers of facts is that data is that we all are focusing on enabling our platforms to ensure that the customer experience is going to be the topmost priority for all of us, right? So are we utilizing these channels to the best possible, or are we undermining some channels' performances or the utility of the channel is what I want to just leave a thought on this. And talking about health tech industry today, healthcare health tech industry today, specifically to RCS, which is the most talked about solution today, channel today, health tech is contributing or consuming around 13% today. I mean, the leading is BFSI and second is the retail sector. Third sector stands to be health tech. And I really, it was for me an eye-opener, I would say. I didn't realize, though being in the same industry and doing that, I didn't realize in terms of contribution, health tech could consume so much from this particular channel as such. So the opportunities are huge, and that is what here we are to discuss. And Priyadarshini also would give a lot of insights, I'm sure. And let us get into the chat. So I have few things to put across to you. So why and how critical is the digital communication for healthcare and tech from customer experience perspective?
So, 2020, I think, was a seminal event around the world, which was a COVID pandemic. And that was a situation where information needed to flow to millions of people around the world very quickly, almost at the press of a button, telling them what the pandemic was, telling them how to keep themselves safe, informing them how to figure out whether they were at risk. And this was a situation where through a combination of digital communications, including IVRs, those recordings which we all found irritating when we were trying to call, but it actually helped save lives because every day you could get a reminder about what you needed to do, how to wash your hands, for how long, what you needed to do to stay safe, what to do if you were in a containment zone. So I think that was a live example that all of us have lived through. Apart from that, the infertility category itself is a very interesting one because it's something which, as a nation, we are very squeamish in talking about. There is a lot of stigma attached to it. There is a lot of privacy issues. Everything around infertility, be it menstruation and menstrual health, be it sexual health, reproduction itself, these are all topics about which the Indian consumer is very squeamish in discussing openly, right? At the same time, Indian families are nosy. There's no question. We've all been through the nosiness. Right, so that is the second thing. The third thing, if you look at census data, is how many families actually have private spaces for the residents, right? It's a very small number if you talk about the masses out there. We do not have this concept of privacy in the home. Rooms are shared utilities. So many years ago, I was doing a research for Samsung on inventing mobile phones for India. And one of the very interesting things that emerged was that the mobile phone is your private space, right? And today that has become all the more evident with the coming in of smartphones, which are now owned by everybody, with the spread of smartphones, whether you're in a public space like a metro or whether you're in a semi-private space like your home, your conversation which happens within that box is yours and yours alone. So for a category like ours in particular, I think digital communication therefore becomes of the utmost importance. And when I say digital, I'm really talking about mobile communication because digital has become almost the first screen. It's with you day in and day out. From the minute you get up, everybody switches on their phone. We are all guilty of this. Until the time that you sleep, even in the middle of the night, if you get up, you switch on your phone. So there's no other device, there's no other screen which comes that close to you. So it's a brilliant means of communication. And with digital, you can start your relationship with the consumer in the health category from before the consumer walks into your center to much after he has left your center. So it enables you to create that ongoing and continuous interaction with them. So therefore, I think it's extremely critical.
Great, great. So in continuation to the points what you mentioned about privacy and stuff, digital communication. How do you think that through digital communication you can let me say create that transparency and reassure that your information or the communication whatever happens is secured? So how is that you see digital platforms or communication platforms play that role to reassure that this is taken care of? And
so I think one is, of course, we all follow rules in healthcare about the privacy of patients and not letting out patient data. But I think very importantly in this category, the conversation that you have is one-on-one and it's on a digital platform. So nobody else can hear that conversation, right, unless you choose to share it. So that's one of the biggest things that digital enables. It enables you to ask questions which you might be hesitant in even voicing out, but you can send a text message to somebody and ask those questions. So I'll give you an example. Again, coming back to my category, it's something where people are embarrassed to talk about the fact that they may be facing infertility, right? They don't want to talk about it with their family and friends very often. So how do they get information if this is happening? Similarly, their family and friends have not told anybody that we have had a child through IVF. How do you get information? So one of the very simple solutions that we have found and that we've implemented at BIRLA Fertility and IVF is what we call a buddy program, right? So this is where when a patient walks into a center and talks with the doctor can give you inputs from a medical basis, but they can't tell you what the experience of going through that particular treatment was. Now for any other health condition, if you have diabetes, if you have an eye problem, heart problem, you will speak to your entire circle and you'll understand what was the treatment like, was it painful, did you do this, what helped. In infertility, you're not comfortable doing that with your known people, right? So this is where we've actually created a way for our potential patients to actually connect with patients who've been through the process. So you can ask those questions which you can only get responses to from somebody who's been through that experience. Yes, I've gone through IVF. How painful are the injections? Okay, this is how much they hurt. What was it that you had to do? No, we didn't have to do this. So no medical advice, but that experience of having gone through is something that we enable sharing through digital conversations. These are conversations that happen through either a Zoom or a Microsoft Teams or something like that. So the privacy of both parties is protected. Only they know whom they are speaking to, nobody else, right? And they don't have to show their faces also if they don't want. So it enables them to preserve their privacy while being honest and while being able to share the information that they wanted to share.
Great, great. So from the brand perspectives, how do you think this entire digital communication platform can be leveraged to do a customized way of communication, especially the cases what you refer to from your industry? These are all the areas which, like you rightly told, people don't open up so easily to talk in the forum. So how do you see that these channels could be utilized to the best? How do you see the brands can leverage to ensure that the communication goes, which is curated specifically to that particular user? So yeah.
I think when you do ATL communication, you're not able to curate. You have to do a broad-based targeting. You'll do it at your most active consumer, and it goes by, right? Whether I create a TV program or something, it's over. With digital, one is it's almost a 1:1 conversation. Two is the consumer can listen to it or watch it or read it at his or her leisure. And you can create communication in multiple ways, right? You can do video, you can do audio, you can do podcasts, you can do written blogs, whatever. So whichever way the consumer is most comfortable consuming that information is available. The third thing is that, of course, one is on digital, you can ask and therefore serve up the kind of content that answers the question the consumer is looking for. And very importantly, you can follow the trail of breadcrumbs that they leave, so that in some way you can almost anticipate where the consumer is going next, and you can be ahead of the curve and you can actually give them what they want before they even know that they're going to look for it. And we know that this has happened using big data, using whatever, right? So that enables you to have a very customized kind of conversation. Now, people in any category, particularly in healthcare, are at different stages of the journey. For us, I'm not talking about them only as customers who I'm going to immediately convert and create business out of. It's as important for us as a mission. As a brand, we're very clear about this mission that we want to create awareness, because just to give you some statistics, there's an estimated 28 million couples in India who suffer from infertility. Worldwide, it's the third most prevalent health condition, yet it's one of the most untreated, and a lot of this is because of lack of awareness. So I actually want to start telling people who are unaware that, these are some of the things that you might want to be careful about, even from before they have infertility. If I can tell somebody, be careful about this, that, or the other, or these could be the signs, that helps them. And that's one of our missions as a brand. Similarly, when people are actually in this situation, I want to demystify, I want to make IVF not a scary and, a dangerous kind of treatment, but something that's very routine. So I can speak to people who are actually struggling with infertility to tell them that, this is one of the most reliable methods. So I can tailor my communication like that. And again, of course, when people have gone through IVF, have been successful or been unsuccessful, I can help them speak to other consumers to tell them what they can do. So there are many different segments that I can communicate to through digital communications, which I may not be able to do in a cost-effective manner when it comes to other media. And of course, this is where having a verified handle on something like a rich communication service will really help, because then consumers know that they can trust the information which is coming their way.
Right. So my next question was about the same, when you are going to have these kind of conversations, and you are also mentioning about a two-way communication which could happen using the solutions, what are digital solutions today we have. So how do you give that confidence to the customers or the consumers? I shouldn't call them customers, I should call them consumers. I don't want to call them as patients also, by the way. So how do we ensure that these consumers are rest assured saying that this is completely safe, secure, and it is then safe, secure? Now I would add on to it saying that how do you ensure or convey to them saying that this is coming from the authentic sources? Because today digital platforms can be misused also to an extensive level. So how do we, or how can we, or what are all the capabilities that these platforms provide to ensure that you also reassure the customers saying that whatever informations you are getting it's all from the authentic sources.
Yeah. So I think first and foremost, like in any marketing situation, particularly in healthcare, you need to be a brand which is trusted. So for that, you need to do a whole lot of activities, digital and non-digital. But once you're a trusted brand like we are, I think it's very important to have verified handles which are sending out information. Because today consumers are also bombarded with all kinds of information from all kinds of brands, and they don't have any way themselves of sorting out the wheat from the chaff, right? So at least if you're a brand that they recognize for being authentic, for being reliable, and then you use verified handles, you use your RCS, you use a Truecaller or whatever else so that the consumer knows where the information is originating, that's one of the best things that you can do. Second, of course, refer to research material, obviously simplified, but refer to research material rather than opinions. So I don't know how many of you follow the liver doc on Twitter, who keeps debunking various myths around whether it's Ayurveda or homeopathy, but he does it using research information so that you know that it's coming from an authentic source. It's not just one person's opinion. That is very critical today in a day and age where I think opinions have become currency. It's important to stick to the facts as a brand.
Which is one area within healthcare and health tech which you see still untapped, where digital communication could play a major role?
I think so. A lot of patients, live far beyond the reach of quality healthcare services. So for people like that, I think earlier in the morning also we had a couple of sessions which referred to teleconsultation. And that's something that we've also introduced in certain markets because honestly, it's very difficult for patients to come long distances for treatment. And if it's not something acute, it's not like mujhe dard ho raha hai or something else where you know that immediately you have to visit a doctor, it's easy to put it off and then live with the regret of not having taken action on time much later on. So for things like that, if we can create means by which we can outreach to those remote areas and provide some level of information, consultation, whatever it is that they need, so that they know whether it's worth their while to make that long distance trek to a better healthcare facility. I think that is one of the most critical areas of distance that we have to cover. Access.
Great. It was good knowing about, and the other point which flashed into my mind is that again these communications could be curated into the respective languages, I would say, which could also help people to connect easily to the information whatever we are sharing. I think that is again the beauty of today's digital era. So be it any language, and on the go it just picks up that language, and same kind of communication is communicated to different geographies and to the respective languages.
Yeah.
So yeah, I think more or like we have covered major topics, whatever I had in my mind. Any questions? If anyone has, we would be open to. Yeah, if someone can pass on the mic.
Is there someone with the mic? I think there's a lady at the first table.
Hi Adithya and Priyadarshini.
Hi,
I'm
hi.
Ayushi from MediAssist. My question is regarding messaging in digital health. The very first thing today's consumers, while are a consumer of health or health tech, are also consumers of BFSI payments and retail e-commerce. They are bombarded, like a consumer like me or a consumer like me is bombarded with endless messages. How do you decide the frequency, the reach, and what is the right time to send messages? Since again, a healthcare industry is not something that you actively market, how do you decide that what is the right time to send a message and engage with the user?
Yeah, so I think that's a very interesting question, and the answer to that is you just have to experiment. There's no, because even within healthcare, there are many different conditions which might need you to look at different frequencies of communication. There might be something where you need to communicate every day. There's something where you need to communicate once in a while, just to let the consumer know that, okay, this is what we've done, or this is where you are, and here's some interesting new information. So to some extent, I think if you can create opt-ins for consumers, that is the best thing. However, in the case of infertility, I think when it comes to patients not realizing that they're at risk for infertility, that's an area where I actually want to actively shout this out. Because we see so many cases where it could have been mitigated or they would have had better results if they'd come early rather than late. So I'm okay bombarding consumers a little bit at that time. Not so much to drive my business, but to say that, guys, be aware. Because here's something that could have been preventable if you had not taken action.
Understood.
So it's, like I said, you have to play it category by category. I don't think there's any one rule that works.
Yes, yes. And adding to that, as it is, regulatory boards have placed certain kind of, criterias, especially when it is promotional, there's a timeline defined. So that takes care of the promotional communications, what are happen. When it comes to the other side of communication, be it transactional messages or especially in MediAssist case more so, you will be taking up with a lot of transactional messaging. Right, so for that there is no time bound. But having said that, under transactional, again, like she rightly said, there is an opt-in. That is the reason we call it as transactional. And these kind of regulations ensure that people don't get bombarded. And it is mindset is what I would say. That is the very reason I placed the data initially when I started the discussion. It is purely a mindset is what I would say, which we don't realize. And somewhere, we undermine the utility of messages. Today, if we do a bank transaction or OTP is not hitting our message, immediately we get panic saying that, no, why is this not happening? Say, for example, you expect some confirmation after a test is done, through, let's say, Tata 1mg or any other platform. And if you don't get a confirmation saying that, yes, your samples have been collected, you might not be, sure that, if things are in the right way. But at the same time, you also don't really value that message which comes and, hits our inbox. So that is the situation today. But like what I was talking about, 71% of today's communication which happens in India digitally is through SMS. And it means to say that people still want that. And the next level of this basic SMS is what I would say as an RCS or WhatsApp, kind of multiple other platforms, OTT platforms, which are available. So even there could be a lot of people who could feel that, they are getting bombarded with. So for that reason, again, everywhere we give an option. Like in SMS, you can have an opt-in and opt-out, right? Likewise, in WhatsApp, you can either report and block and stop kind of options. And similarly in RCs also we have. So we give the freedom to customers to choose what they want to. It is not like, we are trying to push something deliberately to them. But yes, when it is an educative kind of information, so we will have to take a call. And again, we allow with the option saying that, you can choose to opt out later point.
So I have a follow-up question to that.
Yes.
I understand at a brand or a business level, you do not want to bombard or, send the right message, make efforts for the discovery and awareness. Of course, there are messages that, patient could refer to previous and mitigate and reduce their risk of concern. But knowing the fact that 13% of healthcare consumes messaging through whistle or 71% engage through SMS, what exact impact does it create for a patient or a consumer? Regardless of the transactional messages like a report collection. I'm talking about the discovery and the awareness part that you impart.
Sorry, I'm not sure I understood your question.
I will just put it in one statement. What, for the promotional messages or the brand awareness discovery messages that you send out, what is the approximate engagement or impact it creates for a patient or a consumer? A conversion rate sort of.
See, again, it depends on what you're trying to do through the message. So for me, when I'm launching in a new city, we use SMS and we tell, millions of consumers or lakhs of consumers at one shot that here now we have a BIRLA Fertility and IVF center, say in a Jaipur or an Ahmedabad or wherever we are. So there, all I'm looking to do is create awareness. I'm not necessarily looking at creating engagement or lead generation or any of those things. And it's not even maybe a heightened sense of awareness, it's just an information that here we are. And then if you want to connect with us, of course, there is always a callback number and whatever. So it really depends on what you're trying to do with your message.
Understood. Thank you.
So adding to that, there are a lot of scenarios where the brands also have a mechanism to track as to what could be the outcome, what is the outcome, and from there on, how do they, if at all, if there is a different motive or agenda behind it. Now she referred to an example of just creating a brand awareness or their presence in particular city. Now, if someone else wants to derive something out of a particular campaign, that also can be done. So today, there are a lot of brands which use RCS, which you mentioned 13% of penetration from health tech. There are a lot of brands, not in health tech I would refer to, but in a different industry where they measure what is the kind of CTRs which happen through that campaigns. Compared to a normal SMS, what is the the growth they see. From there on, what is the conversions? To that level, we can have a track. So which will directly relate to their spends and their motive or the agenda, whatever they have to achieve. So that way it is measurable. For sure it is measurable. And that is the reason these platforms are still actively being consumed by the brands and by the users as well. One last question. I think he's hinting me. Yes. Yeah, please go ahead.
Sorry, I'll take the last question. So I'm Stuti. I belong to Savin. We are a healthcare fintech company. So basically, we provide a credit line to consumers through merchants or through healthcare providers for everything that insurance does not cover. Okay, my question is that we've been talking about patient centricity, we've been talking about consumers. How about healthcare providers? Where do we see healthcare providers consuming information? Where do we see, and when we say digital, it could be internet, it could be messaging, it could be email. So my my question here is, do we have any insights on where do healthcare providers consume information?
So, I mean, I can answer it for, I guess, the people that we work with. So we connect with a lot of doctors on WhatsApp. To be honest, we found that WhatsApp is the easiest way to connect with them. They typically will open a WhatsApp. They know our, so whether our sales force sends it or whether we as a brand send it. Of course, we also, doctors are human beings at the end of the day. I think all the doctors here would agree as well. So they are on social media as much as the rest of us. So if I'm creating a message about BFI, they are likely to receive it as well if they fall into my criteria of audience or whatever. So whether it's an ad, whether it's a social media, if they follow us, they'll get that messaging on social media. But if there's something specific that I want to communicate to doctors, be it some medical research or a case study or whatever, so we actually target them through WhatsApp, whether it's a video message or whether it's just a simple static message or whatever. And we found that to be pretty effective.
Okay, great. I think respecting everyone's time, we have question. Probably, can we have a one-to-one if you people don't mind?
Terribly
In
sorry.
the benefit of, sorry?
Terribly sorry. We'll close the session now. You can take the questions on later.
Yes.
Don't
yes.
shoot the messenger. We are short on time.
Yes. So I would like to thank Priyadarshini for joining the fireside chat and the entire crowd over here for being so patient and listening to us. Hope this has provoked some kind of thoughts in your mind, and glad to meet you people. Thank you.
Thank you, Adithya. Thank you, IAMAI, for inviting me over here. And thank you all for listening patiently.
Mr. Sharma, Ms. Narendra, I'll request you to take a picture together for us. And again, you can take all the questions you want offline. I'm sure both of these amazing people will be around for a while. Feel free to get in touch, ask the questions that you have.